You can get all different sorts of signs and symptoms when it comes time for a migraine. So what are they? Are they normal? And also, where do these different signs and symptoms come from? That's what we're discussing today. Hi, I'm Dr. Beth, osteopath here at Melbourne Headache Solutions. And don't forget, June is Migraine Awareness Month, so help us spread the awareness this month. So, in terms of signs and symptoms that accompany a migraine, of course we know that we can get pain in the head, but what else can you get in regards to a migraine? Well, some of the really common ones are that you can get neck pain, you can get things like visual disturbances, you can get light, sound and smell sensitivity, you can get nausea, dizziness, vomiting, and some of the less common ones that people are aware of, but that you can certainly get, are things like strong things like brain fog. So I've had people that have come into the clinic and sometimes they can't even recall the conversation that we've just had. Some people get really strong lack of concentration, so they're going to work and they're finding it really difficult to perform their tasks, or they can't watch television or read a book, or they need to read the same chapter again and again and again and again. You've got things like a hemiplegic migraine, where some people lose they get pins and needles down the arm and the leg, they lose sensation, so they get numbness, they lose motor control, so their strength and control over their arms and legs as well. So you can get those sorts of symptoms. We mentioned dizziness before, so you can either get light dizziness, so like a swaying or a rocking sensation, but you can also get the dizziness where you feel like you're in a tilt-a-whirl, like the entire world is spinning around you. You can get this constantly, or you can get this intermittently, so it comes and goes. And if dizziness is your predominant symptom, then this is called a vestibular migraine. So you can get all different signs and symptoms. So are these normal? Well, when they're accompanying a migraine, then yes, they can be normal. So these are some of the most common signs and symptoms, but it doesn't mean that there aren't others. So if you're experiencing different signs and symptoms, please drop a comment below. Some other ones that you can experience are like the aura. This one accounts for nearly 30% of migraine sufferers as well. And you can also get those visual disturbances like squiggly lines. Sometimes people lose their vision as well, and this can happen in one eye or both eyes. You can also get things like constipation, diarrhea, fatigue, and other things that can accompany your migraine as well. So, where are these symptoms actually coming from? Well, there's a portion in your brain that's called your brainstem, and we've spoken about this before. And your brainstem is where all these associated features are coming from. So we've got our cranial nerves that originate from the brainstem, and our cranial nerves, or some of them anyway, are responsible for things like our eyesight, our sense of smell, our sense of hearing, our sense of balance. We've got our vagus nerve that's responsible for our rest and digest, so that can be responsible for making us feel nauseous. We have our vomit center that's located within our brainstem, so that explains the vomiting. So we've got all of these nerves that originate from our brainstem, and so when it becomes sensitized or hypersensitive, then that means that we can get all of these associated features of a migraine that can happen. Now, why does one person get some features and not all of them? And why does your migraine present differently to the next person, presents differently to the next person, and presents differently to the next person? Well, the answer is because we're all different people, and we also get set off differently by different things. So we all know that there's that massive list of things that can potentially set off migraine sufferers, like things like chocolate, red wine, cheese, citrus, bananas, and those sorts of things. So again, similarly to the triggers, these things can set off migraine sufferers, but your triggers are different to the next person and different to the next person, so forth and so on. So we're different people, we're set off by different things, and our symptoms can present differently. And over time, our symptoms can also change as well. So sometimes we hear about people that I used to get only pain, and now I'm getting pain with aura, and now I'm getting pain with aura and vomiting. But now the vomiting's gone, and I've gone back to getting pain with aura, but now I'm getting nauseous. And so things can change over time. They don't have to stay the same. But if you're getting a rapid change for no apparent reason, so you're getting a new presentation of migraine or a new presentation of headache that's drastically different from something that you've had before, this is when we do want to get it investigated, just to make sure that nothing sinister is happening. And if you're ever concerned about your headaches or migraines, you do also want to get it checked just to make sure that nothing sinister is happening. Something sinister happens in a very small percentage of people, but as I said, we always want to make sure and rule out that nothing nasty is happening. But for a vast majority of people, then there is a large percentage of people that the upper portion of the neck is strongly contributing to their headaches and migraines, which is contributing to this sensitization of that brainstem, which is giving you those associated features like the dizziness, the nausea, the light, sound and smell sensitivity, the dizziness, as I said, the aura, all those sorts of things. So the good news is that we can contribute towards decreasing these symptoms and aiming for long-term results. So I hope you found this helpful. That's what we're here to do. We're really passionate about treating headaches and migraines and aiming for those long-term results, because no one should have to suffer with headaches and migraines. So if you've got any signs and symptoms of headaches or migraines that you're interested about, do research about. If you've got different signs and symptoms that I've mentioned and you're interested about, drop a question, drop a query below, let us know, share them around, and also help us spread the awareness this Migraine Awareness Month. Thanks guys, and I'll catch you next time.